Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go to reallifepharmacology.com, get your free 31-page PDF on the top 200 drugs. It's a great study guide, great refresher for those that are out in practice, as well as those taking board exams. Go check that out at reallifepharmacology.com. Free 31-page PDF on the top 200 drugs. Simply an email will get you access to that. All right, let's get into the class of psych meds, talking a little bit of test prep and practice pearls. We are covering the monoamine oxidase inhibitors. Now, I will be straight up front with you. These medications aren't used very often. It's been quite some time, probably a few years, since I've actually seen one in use, somebody taking one. Granted, I work in geriatrics a little bit more, so, more polypharmacy, we run into challenges with drug interactions with these medications. So they are one of the oldest classes of antidepressants. They are highly effective. They are just as effective as many other antidepressant medications. But due to the risk for significant drug-drug interactions as well as drug-food interactions, they are typically not used. So the place you're going to see them used is somebody that's tried numerous and failed numerous different antidepressants in treatment-resistant depression. They are important, I think, to remember. Common MAOIs that you may see or hear of, phenelzine, brand name Nardil. We've got tranylcypromine, brand name Parnate, isocarboxazid, Marplan is the brand name there, and there is a patch formulation. MSAM is the brand name, and the generic name is selegiline. All right, so let's get into the specifics on how these medications work and what they do. So monoamine oxidase is an enzyme in the body that plays a very, very important role in breaking down common neurotransmitters. So it breaks down serotonin, it can help break down norepinephrine, and it can help break down dopamine. So by inhibiting this enzyme, we can essentially increase serotonin, norepinephrine, and potentially dopamine as well. Now, we have a couple of subtypes of monoamine oxidase. We've got monoamine A, or MAOA. This primarily focuses on serotonin, norepinephrine, and tyramine breakdown, which I'll get into later. MAOB primarily metabolizes dopamine and phenylethylamine. Now, dopamine, remember, that plays an important role in Parkinson's disease. And so when we use medications, monoamine oxidase inhibitors for Parkinson's disease, those medications tend to have a much greater slant towards inhibiting MAOB, which is the dopamine piece of it. Now, the monoamine oxidase subtype A, that's going to be your antidepressant type effects, typically a little bit more. So your serotonin and norepinephrine. These medications do irreversibly inhibit monoamine oxidase enzymes. So again, ultimately this inhibition increases serotonin, norepinephrine, and dopamine in the brain. And the thing to note, the important part about that irreversible inhibition is the recovery of the monoamine oxidase activity. So that recovery, because we kind of totally wipe out these enzymes, that recovery may take up to a couple of weeks. And so if you see a drug interaction flash or, an alert that pops up, it's that 2-week time period. And that's the kind of pharmacology and the reason behind that is the recovery of those monoamine oxidase enzymes. All right, so, when do we use these medications? I alluded to that already. It's mostly, very severe treatment-resistant depression. In practice, that's really the only time I've seen them used. I'm not going to talk about the ones in Parkinson's disease in this segment, so I'll leave those out. I do see those occasionally. Again, those are the more MAO type B or subtype B that they target. But some of the potential advantages of monoamine oxidase inhibitors, they are highly effective, and it does give us an option if patients are failing numerous other antidepressants like SSRIs and SNRIs and so on and so forth. All right, so adverse effect profile. They can cause sexual dysfunction just like SSRIs, so that's important to note. They can cause some lower blood pressure at times. Dizziness is a risk. Dry mouth can happen as well. But probably one of the biggest things to know is the tyramine interaction. This is something that is highly, highly tested on board exams. Definitely want to know this for sure. So, like I said, monoamine oxidase normally metabolizes dietary tyramine, so we can get tyramine through the diet. And basically, when you use the drug, you inhibit tyramine breakdown, so tyramine can accumulate. Well, what does that mean? What does that do? So tyramine, especially in excess, can trigger significant norepinephrine release. And so that fight or flight kind of mechanism and some of the action that norepinephrine has, this can stimulate higher blood pressure and can be bad enough to cause a hypertensive crisis, can cause palpitations, so racing heart, those type of things, chest pain, and even cardiovascular complications like stroke, for example. So that's the risk with these medications, is patients have to follow a strict diet and have to pay attention to what they're eating in their containment of tyramine there. So some specific foods that you always hear tested on and you hear about, aged cheeses, cured meats, fermented foods, sauerkraut, certain, tap beers, craft beers, red wine potentially even. These are all examples of foods that are high in tyramine, and using an MAOI medication with taking some of these foods and beverages that are high in tyramine, it could lead to that hypertensive crisis and that kind of tyramine accumulation. All right, next thing I want to talk about is drug interactions. So specifically with MAOIs, they should not be combined with other serotonergic medications. Some of the highest risk meds, SSRIs, SNRIs, and drug with SNRI activity. Think of a medication like tramadol that has some SNRI type activity. Triptans for migraine and some of the other probably less common migraine treatments as well. They can potentially cause issues, so that has to be used extremely cautiously in patients taking MAOIs. We've got TCAs like clomipramine. There's also an antibiotic. Linezolid is a good one to remember. Dextromethorphan for cough. That's another good one to remember. And then St. John's wort can cause some issues there as well. So big risk here is those additive serotonin type effects leading to serotonin syndrome. And remember, serotonin syndrome, diaphoresis, sweating, fever, that increase in body temperature. We can have some hyperreflexia, some tremor, some shakiness, agitation, and CNS changes can happen as well. So really, really important from a patient education standpoint to let the patient know what that serotonin syndrome looks like taking an MAOI. In the event that another provider or they're not paying attention, we have some of these potential drug interactions. All right, let's take a quick break from our sponsor and we'll wrap up with washout periods. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCM, TMS, Naplex. Go check out meded101.com/store. We've got a ton of resources there. We've helped thousands of pharmacists pass their board exam, and we can absolutely help you too. In addition to that, if you're a pharmacy technician, nurse, med student, we've got tons of different books, case studies, clinical pearls. We've got fun stuff like crossword puzzle books. Go check out all those links, all those resources at meded101.com/store. All your purchases there go directly to support this podcast, and I'm greatly appreciative of that. All right, so I want to talk briefly about washout periods. I think this is important to remember. So that 2-week period, I explained that previously. Go back and listen to this again at the beginning. Talked about how that works and why it's a 2-week period due to that irreversible inhibition of monoamine oxidase. So at least 2 weeks should elapse between the discontinuation of a monoamine oxidase inhibitor and the initiation of a kind of another serotonergic agent. Usually that might be like an SSRI. So that 14-day period, really, really important to remember. Also recall that if you've got medications with a longer half-life, so good example. So if you, let's say we're taking an SSRI and we want to go to an MAOI, we want to make sure we get that full washout period. From, again, most medications, it's going to be 2 weeks. But if you've got, let's say we're taking fluoxetine, remember fluoxetine has a longer half-life, and that recommendation is typically up to a 5-week washout period, So really, really important to double check, look this up. If you're going to be, prescribing or dispensing a monoamine oxidase inhibitor, make sure we get that timing right, depending upon the medication we're using. Definitely a good thing to look up, pay attention to, is that washout period. And again, fluoxetine, always a good one to remember. I've definitely been asked that on various board exams. Fluoxetine does have a longer half-life. And in this case, we typically want that 5-week washout period of fluoxetine before starting a monoamine oxidase inhibitor. All right, so some of the most important things here to remember, pay attention to drug interactions. If you have a patient on a monoamine oxidase inhibitor, we'll likely have to, hold or discontinue or avoid certain medications if a patient needs a monoamine oxidase inhibitor. Dietary restrictions, that tyramine reaction, super, super important to remember that. It's going to come up on board exams, and you absolutely should educate patients extensively about those dietary restrictions. Washout periods, just got done covering that. Pay attention to that. Really, really important if we're switching medications, if we're doing something different there. All right, well, I think that's going to wrap up the podcast for today. Hopefully you picked up a few practice pearls. If you did, do me a huge favor. Leave a rating, review on iTunes or wherever you're listening. I greatly appreciate that. Of course, support the sponsor, meded101.com/store. All your purchases there go directly to help support me in creating and doing this podcast. So greatly, greatly appreciate that. If you got comments, suggestions, you can reach out to me at mededucation101@gmail.com. You can also connect with me on LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. With that said, feel free to take advantage of the top 200 drugs, great little study guide at reallifepharmacology.com. It is a free 31-page PDF, and all it takes for access is an email. Thanks so much for listening. Take care, and I hope you have a great rest of your day.